Hey guys, Doc Hepps with UroCoach. So the doc tells you he's going to lift up your prostate. And you're like, what the heck is he doing with my prostate? Why do you need to lift my prostate? Is that the right procedure for me? Well, I'll give you the talk about the Urolift, what it is, whether it might be right for you. And I appreciate your time, so stay tuned. Hey guys, Doc Hepps with UroCoach. So maybe your doc said that the Urolift procedure would be something to consider, and you're thinking, what the heck is the Urolift? Why should he lift up my prostate? What's that going to help me with? Well, we'll go over a little bit about the procedure, why you may be a candidate, why your doc may have suggested it. Urolift procedure is a minimally invasive surgical techniques. And these are techniques that are used for prostate enlargement, gentlemen who have weak stream, poor flow, dribbling, some hesitancy. You get to the toilet and it just dribbles out. Oftentimes you may have tried medicines like Flomax or tamsulosin, or medicines to shrink the prostate like finasteride or dutasteride. And maybe these medicines cause side effects, or they really weren't doing the job. And the doc said, hey, I got a great procedure for you. Let's try this. Well, nothing's as perfect as it sounds, but Urolift, it falls into that minimally invasive type of surgery that may benefit gentlemen who have enlarged prostate symptoms. You have a weaker stream flow, starting and stopping, dribbling, and maybe you try the Flomax to kind of help. That may push your urologist to say, hey, would Urolift be right for you if you didn't like the side effects of the Flomax, or you weren't really into taking medicine? The stepwise approach would be medicines and then these minimally invasive surgeries, which includes Urolift. Another one would be needle ablation. Third option would be something called water vaporization. This is also known as the Resume procedure. Personally, I've done the Urolift. I think there's a place for it for certain men. It shouldn't be applied to everybody, but it's definitely a procedure that works well for the right gentleman with the right size prostate and the right constellation of symptoms. So typically the procedure is done under sedation. It can be done theoretically under local anesthesia. I've never done it. I always do some anesthesia because I think it's just better in my hands. Basically, what happens is the prostate causes an obstruction to the flow of urine. The medicines try and relax that or shrink the prostate, but it's just not doing the job, or there's side effects. So what the Urolift procedure does is it sort of pinches the prostate open, it pinches it against itself, and it deploys a clip so that it opens the channel so that the flow and stream is stronger. The urologist may place between 4 and 6 of these clips to try and create an open channel. It's just a visual just gets when he looks at the prostate. It would be looking into the bladder, and he'd see the prostate blocking it up. And at the end of the procedure, in an ideal situation, he deploys those clips and he can see that prostate is no longer blocking that gentleman up. And that helps to encourage us that you're going to get a better stream, better flow, better symptoms. Some men have a catheter overnight. Some men have it for a few hours. It depends on the urologist's discretion with the Urolift after the Urolift procedure. A lot of guys will have some minor urgency frequency, maybe some blood in the urine. Overall, most men have this for a few days up to a couple of weeks. And the whole goal would be to get you having a better stream, better flow without the need for the medicines, or have a better result than the medications. The next step beyond this would be something called a transurethral resection of the prostate, where that tissue isn't pinched back, but actually cut out or vaporized in some form or fashion. So ultimately, how I do it is a gentleman may come in, he has some urinary symptoms. We do an exam of the prostate, check the PSA level, make sure there's nothing bad going on. Oftentimes I'll try him on Flomax or tamsulosin or a medication, sometimes a low-dose Cialis, 5 milligram, which is known to help with those urinary symptoms. And he says, yeah, it's helping some, but I really don't want to take a pill. I don't like the side effects. Oftentimes then we'll look in the bladder, do what's called a cystoscopy to make sure there's nothing abnormal inside the bladder, and that the prostate's a normal size and appropriate size, that he would be a candidate for the UroLift procedure. And then we talk about it. And if he's interested in doing something to try and get a better flow stream, improve his quality of life, and he's not too keen on taking the medicines anymore, we would set him up. Like I said, it's an outpatient procedure. You come in the same day, you go home that same day. Depending on the time of the procedure, you may or may not end up with a catheter overnight. And most men do pretty well. Does it last forever? The data is sort of still out on that, but overall, most men don't need a secondary procedure, but there's definite risks that you may need something else or to restart the medicines. But overall, most men do well, I would say. So hopefully this gives you some ideas about what the UroLift procedure is, why your doctor may have mentioned it. I appreciate your time. Check out our other videos, and thanks for watching.